blood sugar is a common side effect of diabetes treatments occurring when the body does not have sufficient sugar to use as fuel and has too much insulin. The pathway of insulin secretion begins with the L cells of the small intestine. They produce proglucagon, which is processed into GLP-1, which would then interact with the pancreas to produce insulin. On the enlarged cell membrane of a pancreatic beta cell, GLP-1 binds to the glucagon-like receptor on the surface of the cell, forming a complex called 3-IOL. Adenylyl cyclase is activated. Generates cyclic AMP, which then activates protein kinase A. PKA upregulates the transcription of the insulin gene and produces more insulin to be stored in vesicles. Meanwhile, glucose enters the beta cell via the glucose transport protein called GLUT2. Glucose enters the mitochondria to undergo the Krebs cycle. ATP-sensitive potassium channels close, inhibiting the potassium ions from entering the channel. The insulin-rich vesicles, stimulated by the calcium ions, then secrete insulin from the cell in the process of exocytosis. This excess insulin is what leads to hypoglycemia. Note the symptoms. Generally, symptoms of hypoglycemia like dizziness and hunger start to appear when an individual's blood sugar level is 70 milligrams per deciliter or lower. Managing hypoglycemia. To prevent the occurrence of symptoms of hypoglycemia, it is recommended that you have a snack every 2 to 3 hours. However, if you do experience these symptoms, immediately consume 15 grams of fast-acting carbohydrate, like candy, fruit, or juice. Monitor your blood glucose levels. Once you're back to normal, have a snack to stabilize your glucose levels. If the symptoms are more severe, a glucagon injection is needed. Note the signs of diabetes. Signs of diabetes include weight loss, excessive thirst and urination, fatigue, and blurred vision. If you notice any symptoms, contact your doctor. The earlier the diagnosis, the earlier the treatment can begin. Remember to eat a healthy diet and live an active life.